Depression, defined as feelings of severe despondency and dejection, is the focus of this year's Health Day observance on April 7th. The theme, Depression, Let's Talk. Health Promotion Officer at the Ministry of Health, Ray Goddard, says the main objective is to raise awareness with the hope of reducing stigma and misconceptions associated with depression.
If I spend a day or a night at the Monge Hospital, people just say, oh, she was crazy. Maybe you're not crazy, it's just depression, but because we don't know how to treat with it, we assume that the person is mentally incapacitated, and that may not be the case. So we really need to bring the word out so that we can get the stigma out, and I think perhaps that is one of the problems we have. Because there is a stigma, based on how you're feeling, you don't want to go to the Monge Hospital. You don't want anybody to say you're crazy.
Ms. Goddard says depression can affect anyone, however how the condition is treated can make all the difference.
It can be prevented, it can be treated, but if you are not aware of what you are going through, sometimes it's a bit late, and you might find that depression can lead to other things. God forbid, but it can lead to things like suicide. And so we want to inform people that yes, everybody feels depressed at some point or the other in their lives. Maybe because of some financial situation, because of some social problem or problem at work. Different scenarios could create depression. But it can be treated. And so we're saying, let's talk. Why? Because just simply talking helps to alleviate that problem. I'm certain sometimes, you might have left home and you feel a little down, but when you get to work and you start chatting and laughing with your coworkers, that feeling goes away. It's a similar thing that we're saying. When you talk, you're not necessarily looking for help or advice, but you're just getting something, like we like to say, off your mind.
In collaboration with stakeholders, including the Grenada Psychological Association, the Grenada Professional Association of Social Workers, and the Mount Gay Hospital, the Ministry of Health, from the 2nd to the 8th of April, will host a series of activities surrounding World Health Day.
In fact, we started last week with a series of visits to different schools around the island, where we've been talking to students and teachers about depression. We will also be visiting the TAMCC and the Juvenile Center and institutions of that nature. Of course, we can't do all the schools at the same time, so we're hoping that after the Easter break that we might be able to do more. We're looking at putting a signboard at the entrance to the Monge Hospital, because some people have complained that although they can see the hospital up at the hill, they do not know exactly where the entrance is. And so it is our hope to do a signage that would help direct people to the location of the institution. We've been doing some leaflets and posters and stuff. A lot of it is going to be on media awareness.
The ministry is currently engaged in discussions with the organizers of the Grenada Invitational Meet, and they also intend to engage the churches in its campaign to raise awareness on depression. For GBN Health, I am Joseph McKee-Smith.